service for.
Aaron, I'm going to ask you to just say that sentence once again because the recording's just kicked in. Sorry.
Okay. Welcome, everyone. So glad you're here. Welcome to the Bloomington Rotary Club's weekly celebration of service for April 14th, 2020. I'm Aaron Davis, current club president, and it is just wonderful to see everyone here, wherever you are. And we have people from all over the world here today. And we have special guests. Thank you all. We'll introduce the guests in a little bit. But now I'd like to start with asking Owen Johnson to lead the pledge and to give us a reflection. Owen, please.
Will you please join me in the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which
it stands,
one
nation,
under
under
God,
God,
with
indivisible, with liberty and justice
for
for
all.
all.
Thank you. You may be seated if you aren't already. I want to talk today about the flag and about Ernie Pyle. I hadn't really originally planned to talk about Ernie Pyle, but he fits into the story of the flag. So I thought it was worthwhile to mention that on Saturday, it will be the 75th anniversary of his death on the island of Ieshima off the northwest coast of Okinawa. He was killed about 10:15 in the morning by a Japanese machine gunner after the Jeep that he was riding in came under fire and everybody jumped out. And then another round came and Pyle stuck his head up at the same time asking, "Are you all okay?" And the machine gunner hit him and he was killed instantly. There was a major commemoration in 1995, the 50th anniversary of his death. It was held at Dana, Indiana. Andy Rooney came, a whole bunch of people came, just overwhelmed the small town of Dana. The story was quickly forgotten the next day because the next day marked the Oklahoma City bombing. There was a celebration in 2015 that I participated in at Punch Bowl Cemetery in Honolulu. Another ceremony was scheduled for today. It will take place, but with only about 6 people. Somebody will read the original eulogy that was recited in 1949 when Pyle's remains were transferred there. There was also a celebration or a commemoration scheduled in Dana this Saturday, but that's been postponed. I taught for 7 years a course called In the Footsteps of Ernie Pyle. We learned about his biography, about history of Indiana and Indiana University at the time. And the high point of the course was a trip to London, Paris, and Normandy. We called it In Pyle's Footsteps. And one of the highlights was visiting the American Cemetery above Omaha Beach. At some point, I came up with the idea to ask the students to pick one of the 9,387 graves and find out all they could about the individual whose name was there. And with the internet, many of them came up with some information. One year, I think I gave the wrong impression that perhaps I knew everybody who was buried there or knew about them because we happened to come across a grave with B.D. Irwin's name on it. And he was a photographer that was killed at the same time that Ernie Pyle underwent friendly fire in Normandy in July of 1944. But we had a special celebration one year arranged by our regular guide, Helen Gosselin, who is a remarkable, very vibrant, I would call her a young lady, but she's probably about the same age that I am. And she arranged one year for us to have a ceremony at one of the graves as if we were family. And we went to the grave of Elizabeth Richardson, whose picture Alain will show you shortly. And she was an interesting woman, born in 1918. In 1936, she graduated from Mishawaka High School and went to college in Milwaukee, a small private college. During the war, she and her friends were very anxious about what was happening. And some of them came up with the idea that they would like to join the Red Cross so that they could serve overseas. And with the next picture, you'll see her in one of the, well, this is the first picture. And it shows her in her Red Cross uniform. In order to be in the Red Cross as a woman, you had to be at least 25 years old. You had to be a college graduate. You had to be single. I guess all of these things were designed to make them out of range of the ordinary GI. And they distributed coffee, as you can see here. And she's the second one on the left. And she served there for a while. And then in the spring of 1945, she went to France. Unfortunately, she died in a plane crash flying from Le Havre to Paris. And so she's one of 4 women who are buried in the cemetery at above Omaha Beach. She is one of only 4 women and the only woman not named Mary. When a family visits, the staff brings sand and the sand is rubbed into the name, which is why it looks gold. And at the same time, they put 2 flags in front of the grave, and I'm showing them here. I brought them home with me, 1 French flag and 1 American flag. Unfortunately, we do not have a picture, or at least I couldn't find one, of the 2 pictures in front of the grave. And as we left the cemetery that day, Helen asked me to take the flags. Originally, I was going to donate them to the School of Journalism, but then the School of Journalism disappeared, so it didn't happen. So on this day, we remember the death of Ernie Pyle 75 years ago, this Saturday, and the death of Ellen Richardson.
Thank you, Owen. Thank you. I'd like to move on and acknowledge.
Is it Ellen Richardson or Elizabeth Richardson?
Elizabeth, you're right.
Oh, thank you.
Elizabeth. I'm sorry.
I thought it was-
And we should mention that Jim Madison wrote a whole book about her.
Right. And it's called Slinging Donuts. If you're out of things to do, I highly recommend it. It's a great story.
All right.
I'd like to acknowledge today's greeters, Jim Bright, Ashley Sullivan, Katie Beck, and Alain Barker and Michael Shermis are running things here. Roundabout reporter for April, editor Judy Schroeder. And again, thanks to Michael Shermis and Katie Beck for helping members and guests find their seats. 74. It's wonderful. And now I'd like to introduce the guests, starting with Jim Bright and then Katie Beck. Jim.
Okay, thank you, Aaron. We're pleased to have with us today 3 past district governors, Peggy Peter and Betty Dunham, both of New Albany. Welcome. Judy Bush of Bedford. We have with us today 3 club presidents that I see. Bev Teach from Brown County in Nashville, Brian Hain from our Thursday North Club, and President John Bush of Bedford. So you could tell everybody you were at a Rotary meeting with President Bush today.
Which one?
The important one. And then we have, let's see, 3 members that I see from other clubs. Randy Wheeler, who's our district secretary. Randy's with the largest club in the district, Evansville. Lynn Tiemann from Sunrise, and let's see. Also, we have with us today two of our three global scholars. I see out there Alex Starry, who's joining us from Berlin, Germany. We're at 6 p.m. And Clarice Cross, who almost wins the prize from Tokyo. Clarice is, it's 1 a.m. in Tokyo. If you could circle back to me here in a little bit, Aaron, I'll introduce our district governor visiting from Australia.
Okay, and Katie and Ashley, do you have anyone else?
Yep, I think we have a few more. A guest of Owen is Lisa Schubert-Noling, Reverend at First United Methodist Church. I believe she's on with us here. And we also have two guests of Michael Shermas, Beverly Calendar Anderson, and Jenna Whitaker.
Excellent. Ashley, is there anyone you found that hasn't been introduced?
No, but I'm happy that our newest member has joined us again today, Becky Jessmer.
Oh, but Becky, excellent. So it gets hard to keep track of things when you reach 75. At my age, that's a number of people here.
Yeah, Aaron, and we're pleased to have with us today from Melbourne, Australia, where it's 2 o'clock Wednesday morning. District Governor Shia Smart. Shia, back 6 years ago, this month,
Oh, it's that long.
Shia headed up a group study exchange team that spent, how long in Indiana, Shia? Was it 3 weeks?
4 weeks in
4 weeks.
total. Yeah, it was very enjoyable.
Yeah, if you know, if I could just ask you to for a minute or two to maybe reflect on that and share anything you'd like to share with us.
Oh, it was an amazing experience, the 4 weeks. I had, from a Rotary perspective, and I'll compare the two countries, the district I'm in, 9810, 90% of our clubs meet at night for dinner meetings. So to be going to lunchtime meetings was actually quite interesting. Our largest club is 50 members. So to even be in this Zoom with you having 76 is pretty impressive. And we went to one or two, I think I had a lunchtime meeting which had 150, and it was a buffet dinner, and just, you know, talking to people that size was just amazing. But the people we met and the way we were treated, it was just unforgettable. Everyone was just so lovely. We were taken to places. We went to the Kentucky Derby. We went to an Indiana Pacers baseball game. We went to the Indianapolis 500. I had 3 teachers and a nurse with me, and their vocational days were just spot on. So from a group study exchange, from that side of things, for what they did for their vocation, was just pretty amazing. So it was just, yeah, it was an incredible experience all around. And to be in a suburban setting, but even like the Rotary clubs are in like little country towns, and just compared to how my district is in just Melbourne suburban, it just kind of all blends. It's just, my club is Mont Albert and Surrey Hills. We've got 2 Box Hill clubs and a Blackburn and a Mitcham in the city of Whitehorse. So there's just, we're all kind of joining together. It's not like this one's on their own and you know exactly what your community wants, because it's quite suburbia really, where it was really nice to go, well, this club belongs to this town and this club belongs to this town. And yeah, it was a really interesting experience and just a wonderful exchange. Kept in touch with Jim, kept in touch with Steve, and it's, yeah, very life-changing.
Thank you so much, Shia. It's great to have you back to your Indiana home. So thank you so much. Aaron, back to you.
Okay. You're back to the Rotary family locally. Birthdays this week: Megan Neese on the 13th and Kay Leach on the 15th. And membership anniversaries: Matt Stitzinger, 4 years; Marilyn Wood, 5 years. And now I'd like to introduce Mike Baker, who has some Paul Harris Fellow information.
Can you hear me?
Yep.
We can.
Good. Well, you've probably heard of this before and know that the presentation of the Paul Harris Fellow is Rotary Foundation's way of expressing its appreciation to an individual who has supported Rotary's areas of humanitarian and educational programs. Often a person is made a Paul Harris Fellow because they have made major contributions to our local community and support the many objectives of Rotary International. You know that Paul Harris Fellow is named after the founder of Rotary, Paul Harris, who started Rotary with 3 business friends in 1905. Since then, members of Rotary come from all walks of life and share the service above self ideals of Rotary. Today, it's my pleasure to call up virtually Karen Jepson Ennis, Executive Director of Wonder Lab, the Museum of Science, Health, and Technology. Karen, who's been with Wonder Lab since 1995 when she started as a volunteer and became its Director of Exhibits and Programs in 1998, and in 2017 took over as the Executive Director. Wonder Lab is one of the organizational members of our Rotary Club as well. During her many years at Wonder Lab, Karen has helped develop and implement many educational programs for children, focusing on science, health, and new technology, giving thousands of children a positive learning environment and experience. Her service above self is also evident in the amazing staff and volunteers she helps lead. Wonder Lab has had a profound impact on Bloomington and our surrounding areas. Today, we recognize her for her part in making our community a better place. Karen, I now present you with your Paul Harris Fellow certificate, maybe.
Hang on. Here it is.
There we go.
Thanks to Natalie.
Long arms, Mike.
That's right. I do look forward to giving you your pin in person sometime soon, but I think you got that delivered today, I believe.
Yep. Got the pin.
So I'd like everyone to join me in congratulating Karen Jepson Ennis as our newest Paul Harris Fellow.
Yay. Yay, Karen.
Thank you so much. This is a real honor and a big surprise. And I just want to say that this award truly goes to my team at Wonder Lab. They're the ones who do things every day. And I've been astounded over the last several weeks. Wonder Lab closed to the public, as you all know, on the 13th because of COVID. And we had to switch our entire operations from a super hands-on, public-facing organization to something that's completely hands-off and totally remote. So I've just been astounded by every single staff person. Their jobs have totally changed. They're doing different kinds of work. They're learning new skills, and they've been an inspiration to me every single day for how to just keep learning and doing new things, and to not be afraid of facing the future and doing what needs to be done. So they're doing programming online. If you haven't seen any of these great Zoom programs, I encourage you to just go to our website, and you'll see the links right there. But they've had a tremendous impact reaching one-on-one children who really need time to talk to other friends and to other people that they usually see every day and every week. So anyway, thanks to you for the honor, and I just turn it right to my staff who are so deserving. Thank you.
Thank you, Karen, and congratulations. And we're just all such big fans of your work, and your organization has also enriched the Rotary Club here. So thank you very much for all the people that you've sent over here to, as an organizational member. Now, I don't know that we properly introduced Beverly Callender Anderson, but I want to say hi from the city. And if anyone else hasn't been introduced as a guest, please speak up. We have 3 screens and it's a little difficult to, Beverly, you do such a wonderful job. You're such a joy to work with and to be with. So thank you for being here.
Well, thank you,
Aaron,
Aaron.
we're actually
Glad
up to
be with
4
you.
screens.
Up to, okay. Now a little bit of time for Rotary Action updates. Please check the roundabout for more information. But I just want to, point out that last week we had 46 members and guests. This week, 77. Our board and committees are active by Zoom and by email. Community Services has been doing its work. Communications Committee and the Scholarship Committee will have some results for us May 5th. So there's a lot going on. Please keep active, keep in touch with everyone, keep reaching out to other members who may not be here, just to check in. And our next Rotary Zoom Cafe to socialize for an hour will be Thursdays. Well, it has been Thursdays, 7 to 8 p.m. So just drop in whenever you want, however long. And now, happy dollars. Does anyone have anything to be happy about?
Yeah, I do. Steve Engel. I just learned from Mike Baker that that our club is donating over almost $1,400 toward a effort here in Bloomington that my wife has organized with a couple of hundred people who are quilters to make face masks, protection masks. And they've made 5,000 of these masks so far. And, and they're going strictly to healthcare workers and folks in our community. And they've been buying their own material, but this contribution from Rotary will help offset those costs because they're giving their labor free, and it's quite a noble effort. And it tells them that they're really being appreciated because it's a very important endeavor, I believe, in our community. So I'm really pleased that we were able to help in this effort. And thanks for letting me know, Mike.
And Steve, thank you for championing that cause.
This is
Rotarians are people of action, and we really appreciate stepping up and identifying an issue and helping get something done. Sarah.
Yes, I spoke to Hank Heitman this morning because I was looking for a copy of the book. I just kept walking because Gus Chikalis wanted to buy one. And I'm happy to report that he is feeling much better, hopes to be back with us soon. He was busy reading to his grandchildren in the Netherlands when I went to pick up the book. So Gus, I've got the book, and I know we're all sending good wishes to Hank and hoping to see him here on Zoom pretty soon.
Good.
Okay, Owen.
I'm happy because my friend Mary McGann, who lives at Belle Trace, is now recovering from a bout with COVID-19.
Oh, thank you for letting us know that.
Okay, anyone else?
Right, Aaron, it's Leslie.
Okay.
It's Leslie. Hey, I wanted to say that we are extremely grateful at Stonebelt that we're, 6 weeks in to this coronavirus pandemic, and we are, as far as our clients, COVID free. We have no clients with COVID at this point.
Good.
Wonderful. Thank you, Leslie. Anyone else with a happy dollar?
Yes, I'm trying to get recognized, but nobody seems to hear me. I don't know.
Okay, we got you now, Tim.
Oh, good. I wanted to give a big shout out, happy dollar, to Alan Barker, who sat with me and my wife for a long time to get our computer and our phone going. I don't want to rave on him too highly or everybody will be after him to do that work for them. He loves it. He just exudes joy in doing those things which I just can't stand and don't want anything to do with. But he fixed mine, and he also fixed Wendell St. John. I hope Wendell is on here today.
Yeah, Wendell and I went around quite a while this morning, so he might be on.
Okay. Thank you.
Ellen, I share that. You're a real teacher. I mean, you love teaching and helping people, and that just shows so well. Such a wonderful Rotarian trait. So thank you.
I want to add one more thing, that I was on the phone to Efrat from the United Way, and I said I was going to give a happy dollar for her. She is working overtime to meet human needs and connect people that want to give. And so remember her in the United Way. Thank you.
Okay, now.
This is Sally. I have an Alan related happy dollar as well, which is that, you know, Alan is the longtime board president of Bloomington Early Music. And not surprisingly, we had to cancel our festival that was scheduled for May. Although we were able to pay all of our artists coming from many countries half of their fees, which we were proud of as a board. But we are, instead of having a live festival here in Bloomington, we're going to have a virtual Bloomington Early Music Festival 2020. So stay tuned about that. We've just started to release the information. Of course, Alan and the program committee of BLEMF are responsible for all that good work. I'm just happy to be on the board of directors. So yay again for Alan.
Thank you, Sally. The virtual festival begins May 10th, so we'll be sending information about that. Well, thank you so much, Sally.
I think one last happy from Judy Bush.
Thank you. Can you hear me now?
Yes.
Okay. Yes. Okay. Well, I would like to give a happy dollar for Owen Johnson's description of Pyle, Aaron Pyle, and Dana. My husband's family was from Dana, and we've been through there many times, and been to the park, or Ernie Pyle Park, and his memorial there in the town, and so forth. And such a treat to see Owen. He took care of our newsletter when I was district governor. And if I have a chance, Shia, it's so good to see you. You know, we don't do group study exchange anymore, but what I was wondering was, have any of those, the 4 guests become Rotary members?
One member did, yes. Yeah. But not many do, unfortunately. Yeah, just the one.
I understand. Thank you.
Okay, well, it's time to turn to Michael Shermis to introduce our program for today.
Great, and I'm going to make this pretty quick because I want to leave as much time as possible to get to the topic that I absolutely know is on everybody's mind right now. So Penny Cottle is the administrator of the Monroe County Health Department. She's working with a local health department in a variety of aspects, has provided experience in local, state, and federal government, supervision, management, and the 10 essential services of public health. She graduated from Indiana State University, Terre Haute, Indiana, with a BS in health and safety from the School of Health and Education. And Penny believes in collaboration, which is evidenced through her work on coalitions and committees within the community. With that, I want to turn it over to Penny to talk to us today.
Wonderful. Thank you all for having me. Can you hear me okay?
Yes.
Wonderful. So what a topic, and I'm impressed with how many of you have joined today, and hopefully I'll be able to shed something that maybe is new for you, but I'll also just remind you that information about COVID-19 changes daily and moment by moment sometimes. So some of what we may talk about may change by the time we get off of here and look at the news. But thank you very much. Michael, can you put up the slides and we'll just kind of go through those? And we can just really start with kind of what is COVID-19. And coronaviruses are a large family of viruses. Usually they cause mild to moderate upper respiratory symptoms. So your cold, for example, is a type of coronavirus. But there are times when these viruses that may be found more in animals can kind of cross. And so we've had outbreaks emerge over time that have been of global transmission concern. So you can go to the next slide there, Michael. Couple of examples are SARS. People probably remember that. Severe acute respiratory syndrome from 2002, MERS-CoV, we experienced that. And of course, now we're looking at what technically is SARS-CoV-2 or COVID-19 as we're referring to it. So this is what we're really dealing with now. And we think that it has been passed from animal to human. Certainly because it's new, it's a novel virus. There are things that we are going to learn as we go through and answers that we won't have until we have really been all the way through this and been able to really look at the data. But there are things that kind of stay the same and lessons that we learn as we go. So if you go to the next slide, I want to talk just a moment about transmission. So this is spread person to person when somebody who is ill kind of coughs or sneezes and spreads respiratory droplets with the virus. So we're not talking about something like measles where somebody may walk through a store and just by being there that the virus is aerosolized and hangs out in that store for a long period of time, and just being in there might be a risk for you. This is a little bit different. So we talk about that 6 feet, we're really talking about that distance that those respiratory droplets are most likely to travel. And yes, it could happen if you were singing or even talking. How many of us have spit when we were talking, right? But coughs and sneezes are just a good way to express that. So that's why that 6 feet distance that we're telling people when we socially distance is important. And then less likely, but potential for infection is touching surfaces that have the virus on it, and then touching our eyes, our nose, our mouth. So those things are less common. And we hear a lot of people talking about fear of touching things or, shopping and touching our fruits and vegetables. And we certainly want to, if we are shopping, touch as few things as possible. But we're really talking about, let's say that my husband and I are both near my laptop and he sneezes, and so those droplets fall on my keyboard, and now I'm typing away and then I rub my eyes. So if he were infected, those droplets with that virus then would be on my keyboard, I would be typing, and then I would rub my face. So I would transfer that. So it's less common by just general surfaces. You don't absorb the virus through your skin. And if you could go to the next slide. We'll kind of talk about symptoms. It does in some ways present similar to influenza, but it is certainly not influenza. Some of you may remember back in 2009 when we had pandemic with H1N1, and we really kind of have compared a lot of this current situation to that. That was, I would say, my first experience. Certainly I hadn't been in my position at the health department very long, a year, when H1N1 came around and we had to deal with that. But this is certainly a much greater risk and concern. We were very concerned about H1N1, but this is certainly affecting us and globally much differently than that. So really the primary symptoms with COVID-19, we're looking at a fever of over 100 or higher, a dry cough, and a new cough. So some people have asked, well, I always have a cough. So think about it. Has your cough changed? Is it different? And shortness of breath, difficulty breathing, again, that's unusual for you. There are other symptoms that are a little less common, but may be more similar to that cold and flu. And certainly as we come into seasonal allergy time, we have to kind of think about that and how we distinguish those. For most people, exposure to symptoms are going to happen in about 5 days, but it can range from 2 to 14 days. And we have learned more recently from studies that there's good evidence that people may, in fact, be able to spread the virus a couple of days before they actually develop symptoms. So not completely new. It isn't that that wasn't ever considered a possibility to begin with, but the studies are looking like that that's more of a possibility than what it may have originally been seen. The good news in all of this is that the majority of people will have mild symptoms and they'll be able to recover. But we do know that people who are at higher risk, who have underlying health conditions, people over 60 have seen more complications from the infection and oftentimes have more difficulty in recovering from that. So the next slide really talks about treatment, or maybe I should say the lack of treatment. There is no cure for COVID-19 at this point. There's no vaccine yet. Probably this time next year, we'll be looking at having vaccine clinics and being able to vaccinate people in our communities. There's certainly some clinical trials and things that are more encouraging that may help us look at and treat people with COVID-19. One of the reasons with testing being very limited that we're focused on people at highest risk and our healthcare workers. If someone is sick and they are in the hospital, even though we may not be able to cure COVID-19, the providers need to know if that's playing a role in how they treat and help somebody who is hospitalized at this point. So there's lots of things that are changing in this area. Again, clinical trials that are starting. There's some testing things that are changing, but right now there's not anything that's FDA approved. So really, what's a pandemic? And our next slide kind of talks about this a little bit. In March, COVID-19 was declared a pandemic by the World Health Organization. And a pandemic is really when there's a global outbreak of disease, and particularly something new and novel. So when we talk about COVID-19, again, it's a novel or a new disease that we're dealing with. So it's rare. We don't see pandemics happen very often. And I'm sure you've been paying attention to the news. I mentioned H1N1 a while ago, and we've talked about Ebola in the past. We've talked about SARS and MERS, but something of this magnitude, we're really going back to 1918. And so it is something that doesn't happen very often. And because it's new and doesn't happen very often, we have very limited immunity to it. So that's part of what causes a difficulty with this and how it spreads so quickly, because we don't have that immunity at this point. And as we're seeing, it can overwhelm our hospitals, impact our general public and our travel restrictions. All the things that are listed there and more are things that we're experiencing as a community. One thing that I would just kind of talk about is that because this is rare and can impact us in many ways, the difference with a pandemic like COVID-19 and other outbreaks that we see. For instance, if we have earthquakes, or we have tornadoes, or we have hurricanes that go through, they may affect a state, they might affect several states, but they don't usually affect all of the United States at one time. So with a pandemic like this, we don't have the capacity to help one another with mutual aid the way we would normally do. So when we have those tornadoes that go through, or even if we, with hepatitis A, we had an outbreak of hepatitis A, but we tended to see pockets of that in different places at different times. So communities could assist one another if they needed to, whether that's sending staff or supplies. But with COVID-19, it's global, and we're all dealing with this, and all the hospitals, all of the providers, all of the states are being impacted, albeit different levels. We're all being impacted at the same time. So it's much more difficult to help one another through this time. And with the next slide, I want to share some useful resources that we have, and these are just a few, but I would encourage you to visit the World Health Organization and their website. Johns Hopkins has a global map, and that's very interesting that you can kind of see what's going on across our world, really, on a daily basis. We use the Center for Disease Control, and it isn't on the slide, but the Center for Disease Control is it, and the Indiana State Department of Health are the two websites we're using most often. That both of those have lots of different guidance for people. So if you own a business and you're trying to figure out how you plan for and how you treat your employees, how you clean, how you do something around your home even, there's all kinds of different guidance, and guidance does change. That's one of those things that's hard for us to keep up with. But visit the CDC website or the State Department of Health website and check out the various guidance and updates that they're putting out. Lots of good information. And so if you go to the next slide, we'll kind of give you some of the information. And as I put this together, obviously these numbers have changed because, as I said, they change daily and moment by moment sometimes. But you can see that in the United States, we have a large number. We've had over 555,000 confirmed cases, and we've had well over 22,000 deaths. And most of those have occurred in New York State. Worldwide, we've had over 2 million cases of COVID-19. So this is taken, this information here was taken from the Johns Hopkins University site that I mentioned before. The next slide will give you some information about Indiana. And just in the last couple of days since I did this slide, the state has changed their dashboard, so it has a new look. It will be different from what I'm going to show you. And they are changing the data now. They were updating this map every day about 10 a.m. and now they are updating it at noon. So as of today, Monroe County has 91 confirmed positive cases and 1 death, and there are 662 tests that have been done. Now, one of the things that's with communicable diseases is that normally only positive cases are reported. So while they are reportable by law, it's only the positive cases. And last week, our state health commissioner, Dr. Box, ordered that all negative tests for COVID-19 also be reported. So you're going to see an uptick in number of tests that are being done, but this will also give us a better picture of how many tests are being done, how many of those tests are positive versus how many are negative. Okay, I have that up on my phone, so I'm trying to follow this a little bit. So the map here can tell you county by county. Every county in Indiana now has cases. Nobody has been left out of this so far, but they're also giving you the number of positive cases, the number of new positives, the number of new deaths, new tests, and then the total number of test deaths and so forth. So that's something that's a little new. And you could go to the next slide, I think. Yes, yay. So some of the other things that they have here is you can see that this breaks down demographics, so the age and the gender distribution, and you can look at it by cases and you can look at it by deaths. So when we look at the number of cases, you can tell that it's really a kind of across the board. We're seeing mostly adults, obviously, but we're seeing cases among all age groups. When we look at deaths, then most of our deaths are occurring in people over 60. And in fact, most of them are occurring in people over 70. More men than women are experiencing, we're having more death in men than we are in women. One of the new things, and I don't have it on this slide, but one of the changes that they've made now is that the dashboard is showing you the number of ICU beds that are available in the state. And so as of today, 46% of the ICU beds are available in the state. Ventilator use is included, and there's about 15% of the ventilators that are available in Indiana are in use right now. So there's a lot of information on the state's website, and I would encourage you to visit that. One of the things that is missing at the moment is you'll see that there's a trend line on the metrics by day. And I kind of liked that. I thought that that was good to watch. And on the new dashboard, that's missing. That may come back as we go forward. And if you go to the next slide, we really want to talk about our response, our mitigation, what we're doing to contain, to slow the spread of this infection so that our hospitals are not overwhelmed, our healthcare workers aren't overwhelmed beyond capacity. And, you know, early on, the governor came out with guidance and a stay-at-home order. We know that that's been extended. Our county commissioners have done that same thing. I would anticipate that there very well will be continued guidance and extensions. What exactly those things look like will be yet to be determined. But things like limiting our non-essential gatherings, limiting the number of people that are together, closing in-house dining in our restaurants so that they've went to carry out and call in or curbside. Our businesses, we've seen businesses have to change drastically the way that they're performing business. And we know that this is impacting our small businesses, it's impacting the employees, it's impacting our farmers, but all of this is to protect the health of our community so that we can get through this together and come out stronger for it and avoid having deaths, because we want to keep people alive. We want people to recover from this infection, and we don't want people to die. So if you go to the next slide, what are we going to do and how are we going to continue? Kind of where do we go from here? And again, continue practicing the prevention, those 3 C's, washing our hands, covering our coughs and sneezes, social distancing, limiting who we meet with, where we meet with them, how we meet with them. And so we want to stay connected with family and friends, but we want to keep that distance from them. So can we call them? These Zoom meetings are a good example of ways that we might be able to connect with people. Calling people on the phone, you know, maybe you haven't written a letter in a long time, but you might want to do that now. And wearing face coverings. So somebody, you all donated funds to help people who are making face coverings. I'm happy to say, you know, being from Bloomington, I've got a face covering here for me that is Indiana University. So go Hoosiers. But we all want to be able to, if we are unable to do social distancing, if we are put in a situation where we have a difficulty maintaining that 6 feet, that we want to consider wearing a face covering. And the face covering is to protect the person across from us. So it is, I put my face covering on so that if I cough or I sneeze or I spit when I talk, that those droplets are being contained. It's not necessarily to keep me protected from the other person. So that's why if we can all think about wearing face coverings when it's appropriate and do that. we also have to consider how we clean them. They can get contaminated, and we need to make sure that we're washing them, laundering them appropriately, that we're not just throwing them down and touching them and then putting them right up against our face. So we do need to be careful with them as well. When we come back to our new normal, as things begin to open back up, that will have to happen in some incremental stages and changes. I don't anticipate that there will be any, all of a sudden we're just back to business as usual. We kind of came into where we are in some incremental stages, and we'll have to leave here in that same manner. So I don't have lots of answers necessarily, but I'm happy to take questions at this point.
I have a question. What about handling of our credit cards and cash at stores? Do you have to go?
Sure. Sure. Well, the more that you can limit touching things and handling them, the better. Certainly, if you are using a credit card, and there are a lot of places that are asking you to use your card and swipe that instead of paying with cash, and that's so that there's less kind of back and forth with that. But keep in mind, no matter what you're touching, if it's the credit card machine, when you're done, try not to touch your face, because it's touching that and then touching your eyes, your nose, your mouth, and transmitting the virus that way. And then use some hand sanitizer, or soap and water is the best thing that we can do. But if you're in a store, for example, and you've been shopping and you've checked out, then use some hand sanitizer, clean your hands, and then when you get back home, wash your hands again.
Jim Sims asked a question in the chat about whether there's any information about additional risks or increased risks for people of color, Black people in our community.
Well, we are certainly seeing some disparities in the number of people who are experiencing death and more complications among African Americans. And I think that that's something that we'll have to look at more and kind of watch. Because we haven't had extremely robust testing, so we're testing the people most at risk in terms of healthcare workers, first responders, people with ongoing chronic health conditions, or people who may need hospitalization. That kind of limits us a little bit in the bigger picture of everybody being tested and seeing who might, if it's a matter of who's getting infected. I don't think that our ethnicity is putting us at risk for becoming infected, but it's how it affects us. And that may be related to ongoing healthcare system and disparities that we have across the board. So we definitely want to be looking at those things, and that's where the data will tell us a lot as we go through this. There are a lot of answers that we just don't have right now, but we're getting more information, and as we get through this, those researchers will have a lot more information for us. But it is a concern.
Penny, will you be able to stay? I need to close the meeting now, but will you be able to stay after for a couple of minutes, or just stay a minute or two?
Sure.
Great. So then after we do this, we'll be back. We'll just continue on, but anyone who needs to leave may do so. Let's see. In honor of today's celebration of service, we will provide this quarter's local charity donation to Centerstone. And Ashley Sullivan, will you?
Yes, our next celebration of service will be April 21st on Zoom. And our speaker will be Ann Eskew, providing a discussion related to ACEs, which is short for Adverse Childhood Experiences. A quick note on that: in order to better understand the importance of this in our communities, Ann has requested that everyone answer a series of questions to prepare for her talk, and that will be explained in more detail, and the link will be provided in the roundabout. So look out for that.
Thank you, Ashley. Thought of the week, and this is something that's deep in Rotary. Leaders don't create followers, they create more leaders. If you are willing to do the four-way test with me now. You all ready here, Alan? Okay. Of the things we think,
say, or do. First,
Truth.
truth. Second,
Declare
to all concerned. Third, will their friendships.
Fourth,
Will it be beneficial to all
concerned.
concerned?
And
Fifth,
fifth,
is it fun?
Yes, I like that one.
Yeah. It's great to see you, and thanks for getting up at such an ungodly hour to see our presentation.
No, you're welcome.
Thanks for staying in touch, and I hope those wildfires have died down. Those are horrible.
Yeah, they have. The unfortunate thing is because they're telling everyone to not travel, they're the areas that Easter is normally their second biggest time of year after Christmas. So they had bushfires, and their economy was devastated. And the same's now happened for Easter. So they've been hit double whammies. So once restrictions are lifted, because we believe our international borders will probably be, they won't be encouraging any international travel for a while just to keep the spread down. They're hoping we can have more domestic travel and get the local economy started that way. It's been very interesting times, But thank you for having me. Thank you for making me feel so welcome. It's been very enjoyable. Thank you.
Thanks for joining us.
Do we have more follow-up questions for Penny?
There are several in the chat.
This is John.
Aaron.
Yes.
Aaron, I would just like to thank Charlotte for sitting on the beach. It's been a very calming view of her background. I would mention that, Charlotte.
Okay. And Judy's garden and Kate's Italian village. Or is that, where are you?
Okay. Charlotte, looks like you could do some surfing on those waves there. It looks
Well, it's like Bloomington to me.
Just like Bloomington.
Good question for Penny from Jim Bright. Can you tell us about our 2 Bloomington hospitals? Are the tests readily available? What's the turnaround time on getting results to tests here in Monroe County? How many test kits are available for patients in our community?
Well, I can't answer every one of those very specifically, but I can give you a good idea. So Bloomington, IU Health Bloomington Hospital is doing testing, and they are using IU Path Lab for most of their testing at this time. Even across the state, there are criteria. So the tests are becoming more and more available, but they still have limits on who can get them. So you do have to be symptomatic. It depends on what you do. First responders, healthcare workers are able to get testing. The state has loosened up their testing criteria as well. So some providers can use the state lab and do testing there. But for the most part, it is still, you have to be symptomatic. You have to meet some of the criteria. So it is not widely available to everybody. Testing is increasing. The state has started doing some drive-through clinics. They started in Maryville this week, and they have one planned, I think, in Clark County and one in Vanderburgh County coming up. But again, those have limits to symptoms, healthcare workers, first responders, people with chronic health conditions and those kinds of things. But that will help us kind of get, as we get more of those people tested, I think we'll see testing become more available. There's still some rapid testing that may become available to us in the near future, and that may change things quite a bit as well. I don't know as much about Monroe Hospital. I know that they've done some testing, I believe, but I don't think they have any public testing available that I'm aware of. Certainly some healthcare providers and Some other facilities may use private labs to do testing as well if they want to test their clients. We are trying right now to figure out a good system for getting some of our shelters to have testing available for them, because they do have people in close quarters. And if we had someone who we thought really needed testing, making sure that we get that. So we're working very hard to get testing available, but it does have to be triaged to some extent. So the short answer is we don't have it available for everybody, but testing is becoming more and more available every week.
And Penny, the turnaround time, please.
It depends a little bit on where it goes, but about 24 hours if it is done locally or at the state lab. And unfortunately, if it's a private lab like Quest or LabCorp, those tests are taking anywhere from 3 days to a week to get the results back.
I have a question. Can you hear me?
Yes.
Yes. Am I wrong in thinking that people who are asymptomatic can be carriers?
They can be. The most recent study is looking at about 2 days before they would probably develop symptoms. And it's possible that some people will have mild enough symptoms they won't even know that they're sick. And what I would say to everybody is that's why we have a stay-at-home order and why we want people to essentially self-quarantine, so that we're staying home and assuming we have it and we're not putting other people at risk, as well as not putting ourselves at risk of being around other people who may have it and not have symptoms.
So ultimately, we won't know how safe we are until everybody's tested.
Well, to some extent, yes, and there are different ways. Getting lots of people tested early, it would have been, I would say, a more ideal situation. However, we have to remember that getting tested and having a negative test doesn't keep you from getting infected, and it doesn't necessarily mean you're not infected, because it could be too soon. Maybe you were exposed yesterday and you're incubating and you're not going to test positive yet, and it'll be a couple more days before you might be symptomatic. So there can always be that phase where tests may not pick it up either.
Okay.
And Karen had a question. Karen Jepson-Innes.
Okay, I'll ask my question. Yeah, Penny, it's kind of two-part. One is, are there plans locally to gather plasma from recovered COVID patients and then use that to treat severe cases? I know that's being done in other states with really promising results to treat the seriously ill. And then kind of part two, similarly, is there a plan to test recovered people to see whether they're seroconverted so that they actually have antibodies and are immune and could work in high-risk situations more safely, like the child care, youth serving?
Yeah, and those are questions I'd have to say on a local level that will have to depend a lot on the state for guidance and them doing that. I know that I think it's NIH is requesting plasma from people who actually haven't been infected so that they can look at that. I haven't heard anything specific from the state yet. Right before this call, I was on a state call. They haven't given us any information that they're starting those things or encouraging that yet, but I know that they are talking to the universities and researchers, and so I would say that those conversations I expect are happening, but there's not something yet to share with us. But certainly when we have that information, we will definitely be sharing that. And we are trying very hard. We're using our social media a lot to try to get information out to people and our website. And again, check the state's website frequently because anything like that will be posted there.
Okay, thanks.
Thank you.
Okay, before the next question, I just want to say hi to Clarice Cross from Tokyo. Right? Welcome. And I don't think I said hi to Jim Sims before either. Good to see you.
Oh, good to be here. And I also have Doris as my guest. I didn't get her,
Oh,
didn't get her on that time.
excellent.
So,
There are several questions from people about masks, whether coffee filters inside a homemade mask and what kind of things are going on there.
Sure. Well, remember that we want to keep medical masks for our healthcare workers and people who are dealing directly with patient care and for our patients. So what we're really encouraging individuals to use is some sort of face covering, which is kind of, I think, what you're asking about. Some people are using coffee filters. They're using shop cloths and things as sort of a filter. But remember that that face covering is to keep us from expelling those droplets to other people. The biggest concern, I think, and the reason to think in terms of a filter, if you will, is drying, because if that face covering becomes moist and they tend to be warm, then they can actually be a place where you can have bacteria grow and that sort of thing. So to some extent, my perspective is that a filter, or whether it's a napkin or a coffee filter or whatever it might be, can actually help absorb some of that moisture and keep that dry. It's not necessarily going to prevent germs from getting into you. So, you know, you can certainly use them. And there's lots of guidance on the CDC website for face coverings and how to make them. You don't have to know how to sew. You can use a large table napkin and some rubber bands or bandana, various cut a t-shirt and make them. But I will say that the various groups that are making face coverings are doing a phenomenal job with them. They're beautiful. And I have a feeling that we'll see them around a lot more often going forward.
Okay, anyone else?
Aaron?
Yes, Jim.
Hi, yeah, this is Jim. I sent a question on chat having to do with specific information, how it may affect disparately African-American and people of color populations. But I think Ms. Cotto addressed that during her speech. So I'll save time for her answer for anyone else. And I'd also let everyone know that I believe she's going to present at the city council meeting tomorrow, if anyone else would like to log in. If not to hear us, then at least specifically to hear her.
It will be very short at city council, but yeah.
Thank you for all your help.
Thank you.
We got the Cadillac version.
And thanks to our program chair, Michael Shermis. Thank you. And to our speaker, Penny, thank you so much for taking your time to be here. I know
Thanks for having me.
I know that Zoom meetings are still work.
They are.
It's like watching TV when you're on it. So, are we all ready? So, and thank you, Alan Barker, for hosting this, this room for us. Take care, everyone.
You're very
Be well.
welcome.
Thank you for being here.
Wash your hands.
Come back next week. We'll have more. We'll try it again.
Bye. Bye.
Be safe, everyone.
Thank you, Aaron, for your leadership.
Thank you, Alain.
Bye, everybody.